She is the first one to coin the term nursing process and introduce three steps: observation, administration, and validation. Correct answer all. Next question: which pulse is palpated to assess the effectiveness of CPR? Correct answer carotid. Next question: what is the primary goal of nursing care? Correct answer to promote health and prevent illness. Next question: hand hygiene is essential in preventing. Correct answer nosocomial infection. Next question: which term describe a client right to make their own decision? Correct answer autonomy. Next question: the first step of the nursing process is. Correct answer assessment. Next question: which position is best for a patient experiencing difficulty breathing? Correct answer Fowler position. Next question: which is a subjective data? Correct answer nausea. Next question: which of the following is a normal pulse range for an adult? Correct answer 60 to 100 beats per minute. Next question: which nursing theorist is known for the environmental theory? Correct answer Florence Nightingale. Next question: when making an occupied bed, the nurses should. Correct answer have the patient assist as much as possible. Next question: which vital sign is considered the fifth vital sign? Correct answer pain. Next question: what is the best method to verify an NG tube placement? Correct answer X-ray. Next question: the term asepsis means. Correct answer without infection. Next question: a nurse must report which of the following first? Correct answer pulse of 150 beats per minute. Next question: the best way to ensure patient understanding is to. Correct answer use the teach bake method. Next question: which nutrient is essential for wound healing? Correct answer vitamin C. Next question: what is the normal respiratory rate for an adult? Correct answer 12 to 20 beats per minute. Next question: what is the correct order of the nursing process? Correct answer assessment, diagnosis, planning, implementation, evaluation. Next question: which pulse site is most commonly used in an emergency? Correct answer carotid. Next question: which type of isolation is used for tuberculosis? Correct answer airborne prescription. Next question: a patient's blood pressure is 90 to 16 mmHg. Correct answer hypotension. The best position for a rectal suppository is. Correct answer seams. Next question: a thermometer is disinfection using. Correct answer alcohol. Next question: to maintain confidently the nurse should. Correct answer only discuss patient data with healthcare team. Next question: which organ is assessed when ausculting bowel sound? Correct answer intestine. Next question: which term describes difficulty breathing? Correct answer dyspnea. Next question: a nurse encourages a patient to express their feeling. This is. Correct answer reflective listening. Next question: which is an example of a close-ended question? Correct answer: do you have a fever? Next question: a Foley's catheter is used for. Correct answer drainage urine. Next question: the normal range for an oral temperature is 36.5 to 37.5 degrees Celsius. Next question: which value is considered normal blood pressure for an adult? Correct answer 120 by 80 mmHg. Next question: what is the first step when administration medication? Correct answer wash hand. Next question: what does PRN mean in a medication order? Correct answer give as needed. Next question: which pulse site is used for blood pressure measurement? Correct answer brachial. Next question: what is an example of non-verbal communication? Correct answer maintaining eye contact. Next question: what is the primary purpose of documentation in nursing? Correct answer to communicate patient care. Next question. What is the purpose of a nursing care plan? Correct answer. To provide individualized patient care. Next question. The main focus of health promotion is. Correct answer. Enhancing well-being and preventing illness. Next question. A patient who can't move is at risk for. Correct answer. Pressure ulcer. Next question. The best way to prevent bed sore is. Correct answer. Regular repositioning. Next question. The nurse is responsible for. Correct answer. Monitoring and evaluating patient care. Next question. The observation BID in a prescription means. Correct answer. Twice a daily. Next question. Which is a sign of hypoglycemia? Correct answer. Sickness and sweating. Next question. If a patient falls, the nurse must first. Correct answer. Check for injuries. Next question. Oxygen therapy is ordered. What is used to humidity the air? Correct answer. Distilled water. Next question. Which lab value shows infection? Correct answer. High WBC count. Next question. When documenting, what is most important? Correct answer. Accuracy and clarity. Next question. A nosocomial infection is one that is. Correct answer. Occurred in the hospital. Next question. Which of these indicate dehydration? Correct answer. Dark concerted urine. Next question. The nurse should wear gloves when? Correct answer. Giving injection. Next question. The best for an IM injection in an adult is. Correct answer. Gluteal maximums. Next question. A diet high in fibers help prevent. Correct answer. Constipation. Next question. The nurse use a stethoscope to. Correct answer. Listen to internal body sound. Next question. A patient refuses medication. What should the nurse do? Correct answer. Respect the decision and document. Next question. How often should a nurse check a restrained patient? Correct answer. Every 15 to 13 minutes. Next question. What does the observation NPO means? Correct answer. Nothing by mouth. Next question. The most accurate route for taking temperature. Correct answer. Rectal. Next question. What is the main purpose of wearing gloves? Correct answer. To protect from infection. Next question. What is the normal pH of urine? Correct answer. 4.5 to 8. Next question. A patient is on a clear liquid. Which food is allowed? Correct answer. Chicken broth. Next question. In CPR, the chest compression rate for adult is. Correct answer. 100 to 120 per minute. Next question. Which condition requires content friction? Correct answer. MRSA infection. Next question. Which organ is assessed using precaution? Correct answer. Intestine. Next question. Which of these is a legal responsibility of the nurse? Correct answer. Ensuring patient safety. Next question. Which position help prevent aspiration during feeding? Correct answer. High fowler. Next question. A patient with difficulty swallowing needed. Correct answer. Thickened liquid. Next question. What is the priority during fire in a healthcare facility? Correct answer. Rescue patient. Next question. A pressure ulcer on the epidermis is considered stage. Correct answer. Stage 1. Next question. What is the best way to assess pain in the conscious patient? Correct answer. Ask the patient to rate pain. Next question. The primary concern in infection control. Correct answer. Hand hygiene. Next question. A patient's oxygen saturation is 85%. What should the nurse do first? Correct answer. Apply oxygen. Next question. Which position is used for vaginal examination? Correct answer. Lithotomy. Next question. What is the safety method to move a heavy patient? Correct answer. Use mechanical lift. Next question. A diabetic patient with a foot wound should. Correct answer. Inspect feet daily. Next question. What is the antidote for heparin overdose? Correct answer. Protamine sulfate. Next question. Which injection route is used for insulin administration? Correct answer. Subcutaneous. Next question. What is the antidote for opioid overdose? Correct answer naloxone. Next question, which part of the syringe should remain sterile? Correct answer needle and tip. Next question, what is the correct angle for an intradermal injection? Correct answer 15 degree. Next question, a patient with hearing impairment benefit most from. Correct answer facing the patient and speaking clearly. Next question, a patient with a urinary catheter should be kept in. Correct answer Fowler position. Next question, what is the normal urine output per hour for an adult? Correct answer 30 to 50 ml per hour. Next question, in case of medication error the nurse should first. Correct answer report it immediately. Next question, which of the following promote venous returns? Correct answer elevating the legs. Next question, what is the first action after discovering a fire in a hospital room? Correct answer rescue the patient. Next question, when assisting a blind patient to walk the nurse should. Correct answer let the patient hold the nurse's arm. Next question, how long should the hand be washed to remove germs effectively? Correct answer 15 to 20 seconds. Next question, when transmitting a patient from bed to wheelchair the nurse should. Correct answer use legs muscles and maintaining a wet base. Next question, which is a symptoms of fluid overloads? Correct answer crackle in lungs. Next question, the safest site for IM injection in infant is. Correct answer vastus lateral. Next question, which type of consent is required before surgery? Correct answer informed. Next question, which is a common sign of hypoxia? Correct answer cyanosis. Next question, what should the nurse monitor in a patient on diuretics? Correct answer electrolytes level. Next question, which pulse is checked before giving digoxin? Correct answer apical. Next question, what is the primary goal of palliative care? Correct answer provide comfortable and quality of life.